Enmore's new hospital will be a striking addition to Guyana's healthcare infrastructure. Designed to deliver comprehensive medical services, this facility is set to serve one of the most densely populated areas in Region 4, offering care that was previously accessible only in Georgetown.
What we have in each one of these hospitals, we have 2 operating theatres. So we're standing in the space where the operating theatre is going to be. And next to this is a recovery room. So when we finish operating with the patient, they can go across to the recovery room where somebody would monitor them. Next door to this, we have an ICU. And next to the ICU, we have a whole section that deals with delivery of babies. So we have a section where persons who are in labor would be there. And if we need to do a cesarean section, they go into the other, they can come to one of these theaters, but we also have a normal delivery room on the other side.
The hospital will serve as the hub for healthcare services on the East Coast, reducing the strain on the Georgetown Public Hospital.
We would have accident and emergency, so that's a 24-hour operation. Next to the accident and emergency, we have a suite of diagnostic areas. So we'll have ultrasound, x-rays, CT scans. So they're all in this complex. Then we also have a 24 hours lab. So if people come in here, we can do pretty much anything that is necessary. We can stabilize patients, we can operate on them. If we have a very complicated patient, then maybe we'll need to send that person over to Georgetown. But at this point, a lot of the routine types of operations would be done here.
Major construction of the main buildings will be completed within months, and then the contractor will begin installing the equipment. Dr. Anthony said leading brands in healthcare equipment were selected.
We have standardized them. In terms of the CT scans, we're using Philips. X-rays, we're using Siemens. We have some other known brands. We also have for some of the laboratory equipment, we have worked out an arrangement with Sinopharm to make sure that these are standardized and that reagents for them would be accessible.
With the hospital likely to be ready before mid-next year, staffing the hospital and the other regional hospitals is being worked out.
So we are working on that. We have worked out a complement of staffing, doctors, nurses, other allied professionals, and we are identifying people who would be working in each of these institutions. We have a number of people in training, so as they finish up training, some of them will be working here as well.
The Enmore Regional Hospital is one of several being constructed across the country. Reporting for the newsroom, Neil Marks.